To get this started, I'm just going to have our panelists quickly introduce themselves and who they are affiliated with or what they do. And then if you have a question specifically that you would like one of them to address, please come to the microphone. We can do it that way. If not, the reason that we're doing this is we really feel that it's important. After you've been here for a full day and gained all of this information, we want to make sure that you walk out the doors with your questions answered the best we possibly can. So that is the reason that we're finishing up this conference with a question and answer. So again, thanks for being here. Dan, if you would just go ahead for those that maybe hadn't attended your class, introduce yourself and then just what you do.
Hi, let's see. Are we on? Can you hear me? Yes. All right. My name is Dan Gray, and I am in Salt Lake City. I have a private practice. I'm co-founder of the LifeStar Network, which is a program geared for helping individuals and couples and families that are struggling with pornography and sexual addictions. Have been here in practice for about 30 years or so here in Salt Lake. So it's a pleasure to be here with you. Thank you.
So, hi, I'm Dorothy Maryon. I'm a clinical mental health counselor. I'm also in private practice, but I contract with the LifeStar program, so have worked with them for about 17 years. I mostly specialize in women's issues for the partner, dealing with a husband or a wife who has a sexual addiction. That's pretty much what I do.
My name is Mark Bell. I'm a marriage and family therapist, and I'm also a certified sex addiction therapist. I work with Psychological Counseling Services in Scottsdale, Arizona. We're also known as PCS. It's our acronym. Been with them about 6 years now, and I work primarily in their intensive outpatient program where we have individuals come in from anywhere from 1 to 3 weeks for intensive outpatient therapy, 10 to 12 hours a day, 5 to 6 days a week. During that time, they get the equivalent of a year's worth of therapy during that time. And it's our focus in my work has been to help folks that are struggling with whether or not their individual therapy on an outpatient basis is enough on a once or twice a week basis, and not necessarily at a stage where they need inpatient care for 30, 60, or 90 days. And so we have a program where they're able to come and do very intensive work with a treatment team of 6 to 8 therapists that will be assigned to them, and it's a pretty comprehensive approach. And it's not just sexual addiction that we deal with. We deal with various behavioral and emotional issues as well as addictions. We have become quite adept at dealing with the betrayal trauma with spouses and ushering them through a process of healing where they might be in a stuck place to get them back to a place of malleability with their home treatment team or therapist. I do work a lot with men struggling with sexual compulsive behaviors, but it's been a really great treat to be able to work with an entire treatment team in a large private practice. There's about 25 therapists there, all of us in private practice, but under the umbrella of PCS.
Okay, thank you. These are some great questions. Thank you for asking them. I will just ask our panelists if you can gear your remarks to maybe a minute to a minute 30 seconds. And then if any of the other panelists want to add some comments additional to the ones that I have asked, then feel free. Dan, I'm going to give this first question to you. It said, what should I do if my husband has finally admitted porn use but doesn't want me to tell anyone, including grown children? 4 of which are boys addicted to pornography.
That's a very good question and a very commonly asked question, especially in the first phases and stages of recovery work. It's apparent that the information has either probably come to this spouse through either finding material on a computer, or maybe the husband is disclosed. Obviously, the husband is not in a situation right now where he's feeling like he wants to have others be aware, and that eventually, if the couple gets the help that they're going to need, he will become desensitized to that fear of having other people find out about his problem, because there's a lot of shame that's associated with this issue. Most addicts have a very low self-worth, feeling that they're not worthy of people's love, and they are usually very good at maintaining a double life, trying to sustain some form of normalcy in their life to indicate that they are okay, that people can think that they're all right, where inside that they're feeling very, very shame-based. So it's important for a spouse to be aware of that, and that he's going to need some time to be able to feel comfortable in reaching out and being able to get the help that he needs. I would suggest to this spouse that she get help for herself, though, and to get some direction and guidance as to how to navigate through all of this, and so that they together can be working through their programs.
Can I add to that? Is that okay?
You bet.
Yeah. I actually love what you're saying, Dan, and what we really come across quite often is what he was describing is a spouse really uncomfortable with this information getting out, and when that information stays locked within the family system, and mainly just between the husband and wife, we really see an increase in anxiety and distress between both of them. It really hampers the person trying to recover's ability, as well as their ability to create trust and traction and momentum in the relationship. And so being able to have people that they can reach out to, both of them respectively, to speak about this. And there will be a time and a place that's appropriate to speak to children, whether they're underage or adult age children, to speak more and more specifically over time, because a family that stays locked in their secrets stays pretty distressed. And when that happens, it really diminishes their capacity to create the kind of connection and the emotional attachment that's really critical for vitality and really helping a family move along. So I just wanted to add that component, really just reinforcing what Dan said.
Oh, we get all three of them.
Okay. Also, just probably recognizing for the partner that wrote that question that there's a lot of trauma going on right now. And there's that sense of wanting to protect and share with the children. And I kind of, with what Mark is saying, to be able to get stabilized first. But what happens with a lot of partners is you find out that your husband's got this pornography addiction. He doesn't want you to tell anyone, and then often the partner will feel like now she becomes the secret keeper.
Right.
And so starts to isolate and withdraw because I have this burden now and I can't share it, and I can't protect my children and talk to them about their issues. And so the sooner both partners can get help, the stronger he'll become, where he can manage the story and her trauma can calm down enough to then gather in the children and do what's right for them.
Okay.
Hopefully they're involved in couples therapy at this point early on, and we don't delay that, because there's a lot of quarterbacking that couples therapists can really do that an individual therapist won't necessarily be able to have the capacity, because they don't get to see both partners. And so a couples therapist is critical in the early stages, just for educational purposes, to understand what's realistic and what's unrealistic, and what's expected reactivity or responses, and yet what's dysfunctional, that's a strong term, what's ineffective about that strategy.
Excellent. Okay, Dorothy, I'm going to give this question to you, please. I'm working with a man addicted for 20 years. He says his wife actually feels physical pain during intercourse. Could her emotional pain from dealing with this for so long actually be causing this physical pain?
Great question.
Yeah.
So I'm not a physician, so I think I would. Obviously, there's a lot of reasons for physical pain in intercourse, but kind of what some of the latest research says is that unless there is a level of emotional safety within a relationship, that is going to play into the sexual experience. Okay, and so yes, I think that can show up in a physical way, sexually. And feel free to add to that.
You know, we had a person come to PCS a couple months ago. We do a monthly networking luncheon that we invite different professionals in the area, and we had a woman, a doctor who was a director of sexual medicine at the local Banner the Banner Hospital System out in Arizona. And she really educated us even more so about the value of having somebody that's in sexual medicine. And that's an actual division of medicine, and yet there's not a whole lot of awareness around what these doctors can offer a person struggling with perhaps some painful sexual experiences, intercourse or otherwise. There may be a biological component, there could be a psychological component, but a lot of it really comes down to educating them about their own bodies on top of what may be happening on the side in their relationship. And so having a good relationship with a sexual medicine professional within your practice as a therapist has been really critical for us. So if you're having that experience, I would invite you to work with your therapist, to consult with a sexual medicine professional who can really guide you through some of the physiological nuances that really are outside the scope of some of what we do from a clinical standpoint. We're all about staying integrated with the community and really accessing as many resources as possible. And I would never want to proclaim that I had all the answers, but I can definitely do my job to help you find people that can get those answers.
Excellent. Mark, let's go ahead and have you
Yeah.
answer this question. I am finally going to seek out a sponsor for the first time. I have a problem and a fetish. How open should I be with the sponsor? Should I share details?
Straightforward answer, yes. Your sponsor cannot truly be helpful with you if they do not know what you're really struggling with. Now, it's important that we're not doing it just for gratuitous sake, just to see what kind of reaction we can get out of them or gauging their response. And when we're interviewing people to become our sponsor, we really take some time on the front end to have a temporary sponsor while we're really looking for a more nuanced approach to the sponsor that I'm going to keep on a permanent basis. Meaning, when I start recovery, I need any sponsor at that point. I need somebody willing to be a temporary. And you can go to 12-step meetings and always request, is anybody willing to be a temporary sponsor while I'm looking for a permanent sponsor? And when you're looking for a permanent sponsor, you're paying attention to the different people in those 12-step meetings and those recovery meetings that have traction in their recovery, that have momentum, that speak confidently about their recovery, but from a place of humility, that demonstrate a consistency. You're looking for somebody that's very seasoned, and in so doing, you interview them and you pull them aside and say, I'd really like to consider having you as a sponsor. Can I take you out for lunch or something and get to know you? And when so doing, you want to be able to be really clear. I want to be fully open with you. Are you comfortable with me being very clear about my fetishes or my sexual struggles? Because that person can only be as helpful as they have access to information that you're currently dealing with. And I don't think that a therapist or a sponsor should have any more or less information than the other. They should be working hand in hand to help that individual, being very transparent.
Okay, thank you, Mark. Hope that helps.
Just a thought, real
Dan?
quick.
Okay.
That the 12-step program is a volunteer system, so you're going to have some sponsors that are really seasoned and many others that are just now getting into their sponsor role. Mm-hmm. So I would concur with Mark. You want to talk to them and be very direct, share exactly what you're dealing with, and ask them if they are comfortable in dealing with you, because some sponsors may not be comfortable in dealing with certain types of sexual improprieties.
Mm-hmm.
Okay, Dan, let's keep the microphone with you, please, because I know that in one of Dan's sessions, he talked about truly letting go. So it says, researchers and therapists often refer to addiction recovery as a lifelong pursuit. How would you define addiction recovery? And is there a point when the addict has fully recovered?
We have a couple hours on that one. We have a couple presentations on that one. Yeah. Just very simply, a slogan or a phrase that we usually use at our program is that recovery is not about sobriety and abstinence. It's an important part, but true recovery is a lifestyle change, and it usually incorporates, in fact, I wouldn't say usually, it always incorporates other issues that are aside and different from just the sexual acting out behavior. And so people usually start their addictive patterns as either youth or young adults. Some pick it up afterwards, but it's usually initiated in those years. And they use that behavior in order to manage and cope with life. What started with curiosity, then some experimentation, turns into habitual patterns, and then addictive patterns. And that can be a long-term process that it's been a long-term coming, and it takes a long time to then fully recover. So the person learns how to manage their anger differently. They learn how to manage their boredom or their loneliness or their stress in different ways. And then they, through the process of recovery, they are able to find other methods and ways of managing those parts of their brain that are firing off that are very difficult to control, dealing with their cravings. And so it's a long process, and most clients, even when they have stopped their behavior and it's been for a long period of time, still feel a need to continue their therapeutic work. That doesn't mean always going into therapy, but they certainly need to maintain and sustain, in my opinion, their daily routines and rituals that keep them centered and focused on their recovery, on their managing life in a healthy way, because it's easy to get complacent over time. If there isn't the acting out, it's easy to get complacent. So keep up the energy and keep the focus for a lifetime.
Can I add to that real quick?
Yes.
Just really briefly, I was talking with a man who had quite a bit of recovery, I think 4 or 5 years. And kind of this idea of once an addict, always an addict came up. And he described it this way. He said, when I started out in recovery, he said, it was like I had this raging river running through my head. And I was on the banks of that river, and I dipped into it. I stayed by it. I was often swept away by the river. And he said, as I recovered, as I learned how to manage my emotions differently, as I learned to connect with others and ask for help and all of the things that go into recovery and changing his lifestyle, he said, I began to build a path, he said, away from the river. And as I went further and further, the path led me into a completely different territory, a completely different landscape. He said, but I could always hear softly, the further I got away, I could hear the river in the background. And he said, I'm to a point where I can barely hear it, but I know if I do certain things, I can find myself back at that riverbank really quickly. And he said, so I'm recovering. It's not driving my life anymore. It's not the center of all that I do, but I am very careful and conscious of continuing to create the distance between myself and that river. And I thought that was a good way of saying that.
Thanks, Dorothy.
You know, having a healthy capacity to be really aware of your ability to self-sabotage is always a good thing to keep at the back of your mind. But it's not something that you have to keep at the forefront that's always ever present, that I'm probably just one step away from messing up or screwing up. And as I love what you said, Dan, is that it's a lifestyle change. And when I phrase it to the clients I work with, I said, look, ultimately it starts off as recovery. You're in addiction recovery. You're trying to get sober. But as you adapt to this, it's really going to become what other people call healthy living. And so you're not in recovery, if you don't want to call it that, but you're still doing the same concepts. Healthy people are doing what recovery has labeled recovery. And so when we get to this new lifestyle place, it's not some awkward paradigm shift. It's literally aligning with what the average healthy individual, I don't mean perfect, but the average healthy individual is doing on a regular basis. They're staying in consultation with people in their life. They have balance in their mental, emotional, and physical well-being. They live in a way that's spiritually congruent with their values, and they don't keep everything bottled in. And so recovery is what we call healthy living in the mainstream world. So yes, we may always be in recovery if that's what we're looking for, but it doesn't have to be framed as the intensive, every day doing a 12-step meeting and seeing my therapist every single day. That's the front end to build the momentum. And then as you get traction and you adapt to other relationships and building connections outside that support you and buoy you up, then you're able to moderate that well in that consultative process.
Thank you to all of you. Dorothy, this question will be for you, please. How do I, as a wife of a sex addict, find peace and work through my trauma when my husband continues to keep things from me? Is it possible?
Yeah, that's a good question.
Can I see the question? I think that is such a big challenge. I think I was thinking today as I've talked a little bit about attachment in relationships, that becomes a really difficult challenge when things are continued to be secretive or kept from the partner. So it creates a level of disconnect that is really almost, it's very, very difficult to navigate around that. And so typically I think what I would suggest is that as a partner, that you take on the job, so to speak, of taking care of and strengthening your own self within that relationship, that you stay very congruent to your own values. And so you respond to your partner the best you can with kindness, with love, but also get the strength and the help that you need in order to be able to set boundaries that say, there are certain things that I need in a relationship in order to be safe, in order to be connected to you. And I long for those. And if you're staying in that relationship, and you say, and I am waiting for the day that I can have that, but I can't promise that when and if you choose to join me in this journey, that I'm going to be able to reconnect with you. Okay? And so, but that's kind of the path that the spouse is left with if the addict is unwilling at that point to be open. But often what happens is as the spouse gets stronger, the dance, so to speak, that the relationship has been in stops because she no longer dances. It's like I'm no longer going to do this deceptive, difficult, disconnected dance. And as she stops and gets strong enough to stop, then it opens up space for a new dance to come into place. And so often an addict at that point may join her in recovery, may decide going to see if I can't get through this. And then hopefully together they create a new dance. But all I can say is to work at your own healing, your own sense of peace, maybe not within the relationship, but with your higher power, with your connection to other people, and a connection to your own authentic self.
Okay, thank you. I'm going to read this question. I think we have answered it, but I just want to make sure that we have done what we needed to do for you. Once you have graduated/finished LifeStar or any other group therapy, how can you keep moving forward without slips or relapses? I am getting close to finishing phase 3 and am honestly a little nervous to face the world. Okay, I think that falls into the same area as far as a lifelong recovery, but is there anything else that you would like to address, being the director and founder of LifeStar? Dan?
Dorothy, what do you think? I would just say that if finishing the phase 3 is not really the determining factor as to whether or not a person is ready to stop a program or the process of recovery, at least in the therapeutic setting. Maybe there are still things that need to be worked out on an individual basis. Maybe it's not through the group process, but on an individual basis, seeing someone for accountability for their treatment plan that they've set up for themselves. So there's a regular, consistent reporting back if that hasn't been established by someone else in the community. Because to maintain and sustain an environment and a community of support is really critical. Most find that the group process provides that, where there are other men, other women who are aware of your issues, that are aware of your vulnerabilities, and that are willing to call you out at times if you're needing that. And so to have a continuation of a relationship can be very helpful as well, even if it's not in the group kind of setting. We have quite a few of our clients that they finish up with phase 3 and they move, they go back and they now are accountable to maybe their brother that they have connected with, or their group that they continue to have interaction with. Knowing what you've done to sustain your recovery to this point, maintaining and sustaining your regular daily routines, staying engaged in your recovery. It doesn't have to be through the group, but there can be a real power in reconnecting periodically with that community of support.
Thank you. Mark, let's give this question to you. I have had both great and not so great therapists. Is there a method or a general way to vet a therapist in order to find a good fit early in the process?
We'll just roll the dice.
Ouch. That's funny. Yeah, that's a great question, actually. I hope I cover the criteria when I go get interviewed myself with clients. First and foremost, if you're going to see a therapist dealing with your own sexual or pornography struggles or what have you around this, it's critical that therapist have not just training but experience working with this, not just with the individual for the addiction purpose, but also have had some experience working with the spouse or partner in that relationship, because there's so much about recovery that can be missed if we're not bearing in mind the impact that it has on the partner and or children or other members of that family. And so if this person, this individual that you're interviewing has not had those experiences, I wouldn't necessarily rule them out, but I would definitely invite them to educate you on how do you plan to address this then? How do you intend to treat my condition, my situation, with regards to how it's going to impact what my life is going to look like at home when I'm not here in your office? How do you support my spouse and me supporting my spouse? How are you going to coach me to understand the nuances of what my children and wife might be going through, or my children and my husband might be going through, or my partner, what have you? That's a critical piece. If they haven't had those experiences, but they can at least give you a competent response that speaks to being able to nurture that individual, and they would be encouraging you to encourage your partner to get a parallel process going on, that means that therapist is very astute in the needs of a relationship around attachment and bonding and safety. It really is at this stage of the game important that when we're dealing with somebody that has a sexual compulsivity or a pornography addiction, that the therapist be getting some contemporary training beyond what they might have gotten in grad school. In fact, I got virtually no training around this in my grad school program, and I only graduated maybe 8 years ago, give or take. We've come light years, and it's not necessarily a good thing, but we've come light years in our in the growth of the pornography problem, in the sex addiction problem. And unless a therapist is on the cutting edge of the contemporary challenges that are being experienced and knowing how to ask the right questions about what they may or may not be experiencing, we might be missing a whole lot. So if this person is getting some training, some specialty training, whether it's through the CSAT program or SASH program, or I imagine LifeStar has ongoing CEUs, if you will, anything that person is indicating that they're continuing to get educated around that, and that they can give you at least not so much a detailed plan, but a vision of what they're going to do and how long it might take to get to certain benchmarks. That would be really critical. Unfortunately, I've worked with many clients who have worked with therapists that are really good at other things, and they've been really effective at treating other things. But when it came to the condition, it's much, I gotta be careful. Some of the feedback that they've gotten was actually contraindicated for this situation. It would work in a different family or relational struggle, but with this one, there's some very specific things that we've got to be very mindful of, and the betrayal trauma is really critical. So I know I'm talking a lot about the spouse or the partner piece, but we just can't underscore how much that will undermine one's desire to stay in recovery, because if I'm not able to attach the people closest to me because I'm doing things that are self-serving in recovery, but it prevents me from staying in a connected space with my family or significant others, then I don't sustain a whole lot of momentum or motivation to stay in that recovery path. So there's not doing the one without the other. Now, if you're a single individual, you have no significant other, these same questions would apply. What training have you had? What are the skills that you bring to the table? What would be the plan of action? What has been your experience with these situations in the past? What have your clients or patients told you in the past about the work that you've done with them that's been most helpful and least helpful? And you really want to get a rapport. You want to get a sense that this person is going to come from a non-judgmental but a very firm and very care-fronting place where they're going to hold your feet to the fire, but you feel a sense of value coming from them in their care-fronting.
Thank you. Dan, please, on this one. This gentleman says, I'm a red-blooded male. Is my brain producing dopamine for the physical attraction I have for my wife, or does it take viewing pornography to produce this? Why are we not all addicts to this?
I may want to look at that question as well.
That's complex.
Thank you. Getting into the brain science, and it's a bit tricky when it comes to each individual's production of dopamine. We're all a little bit different. So my answer to this gentleman may be a little bit different than to someone else. But first, the recognition that there are strong desires and cravings that are there that can go unmanageable very quickly if not monitored well is very important. To have an awareness of one's vulnerability, what kinds of triggers are there that one needs to be constantly aware of, and awareness of one's physical attraction to one's spouse, and so to nurture a healthy physical relationship with one's partner outside of the pornography issues. Pornography is very detached, disconnected counterfeit for a real relationship. And so though the same dopamine is being activated, the same neurotransmitters of endorphins and adrenaline are being then activated in the body during sexual relations with one's spouse. And the same, if we were to go inside of the brain, we'd probably see exactly the same kinds of reactions, responses chemically. But it is, where is my mind focused? Is there an emotional connection that I'm nurturing with my spouse? Sexual relations go far beyond just what arouses a person sexually. It has to do with emotional bonding. It has to do with nurturing. It has to do with battling for each other, living life together. So that dopamine and all of those chemicals, the oxytocin that Dorothy talked about earlier in her presentation, that bonding hormone, is activated whether we are involved with our spouse or whether we're looking at pornography. And so we make those choices as to which target, which person we're going to allow those very powerful chemicals to bond to and to be focused toward. And so being very careful on an emotional level, and then in one's mental practices of where one takes those cravings and desires and channeling them to that person that you love.
Thank you, Dan. Dorothy, this question would be for you, I think. My spouse cheated on me for a number of years without me knowing. He has since come clean, worked through the 12 steps, participates in therapy, etc., and has 2+ years of sobriety. I'm still scared to reconnect and trust him. Do I trust him to change the laundry? Yes. Trust him with my heart and feelings? Not so much. Suggestions for baby steps back to reconnecting.
I think probably the first place that I would suggest this person goes without knowing if they've already done this, but it would definitely be time for some marriage therapy. some pretty powerful emotion-focused therapy and working on the emotional connection and safety within the relationship. Because the events are over, but the connection isn't still there. And it takes a lot to get trust back. But to be able to work on that in a partnership is probably the best way to be able to do that. And I think trust, it's not a black and white experience. It does come back slowly. It comes back with consistency. It comes with the person that here has cheated, learning how to battle for his partner. And I think that often takes a little bit of guidance in how to do that. Want to add anything on that? Yeah.
You know, I like what you say. There's definitely, when we've worked with the spouses and they're in these situations, it's not always the case, but we have some really skilled therapists on staff that will do different explorations with the spouse. Sometimes some EMDR has been helpful. It's a certain treatment modality that there's many practitioners throughout the country, and when done effectively, it can really help to reduce the reactivity to certain triggers for the trauma that's been enacted upon the spouse. It's not a foolproof method for everybody, but it is a really good resource for helping to create safe place within and to have less reactivity around, so it allows them the chance to take emotional risks with the person that has harmed that trust. And so again, in conjunction with the couples therapy, perhaps EMDR may be something, I'm not recommending it for everybody, but may be something in consultation with your therapist that may be an avenue to explore and to see what benefits might be gained from that. And the specifics of that would be something to talk with your therapist. Now is not necessarily the time to go into the details of it, but it is a certain treatment modality that's been proven very helpful in many cases.
Okay, Mark, let's keep you with this one. With the normalizing of porn in our society as recreational and just a part of being human, reaching a climax, if you will, with the popular book and movie 50 Shades of Grey, how do we speak clearly about brain studies and the right and wrong when it comes to pornography? What are we recovering from if it's not a problem?
That's an interesting question. Yeah, 50 Shades of Grey, it actually... it tapped into something that I don't think a lot of the population was really conscious of, but we really still struggle very much with understanding our own sexual appetites and desires, and more importantly, our sexual curiosity. The book in and of itself and the subsequent movie, you know, these are fictional characters, but they do definitely depict some unique expressions of sexuality that for many people found it to be very offensive, very harmful. In many ways it was. You look at some of the nuances and it really was just quite profound, the descriptions. I never actually saw the movie or read the book. It wasn't of interest to me. But my peers and colleagues that saw it, they were quite astounded by it, but at the same time quite intrigued by the public response to it. So what we're talking about is a culture where we're very curious about the different aspects of our sexuality and being curious about what I might be interested in. Is this okay? Is it not okay? Is it taboo? Is it not taboo? And there really is a wide spectrum of our sexuality, and it's really important for us to recognize that we don't all fit on the same quadrants within it. But insofar as we're engaging in sexuality that is non-abusive, it's non-exploitive, it's something that both parties are enjoying and feel respected and valued in, then those are the healthy components to a sexual experience. When we start looking at what are we dealing with in the culture, absolutely the as I think you said, the pornification or proliferation of pornography is really altering what we accept, or what we begin to start believing is the accepted or what the expected sexual experiences are. Quite often work with individuals who are questioning whether or not they should be adjusting their sexual template to accommodate their partner who is now accustomed to these images and these experiences that they've witnessed or experienced outside of the relationship, in fact. And so I'm probably going off trail here on the question, but when I think about what are we dealing with here, we're definitely dealing with an opportunity to have some really comprehensive conversations with our significant other, and definitely starting with our children, having some really healthy sexual health conversations earlier and earlier at age-appropriate levels. And we need to continue to have those conversations all throughout our relationship with our partners and spouses. Unfortunately, we engage in sexual activity far more often than we actually talk about it. And when we do talk about it, it's typically in hushed tones or in crass tones. And we really want to get into a place where we can use whatever is being produced out in the universe, out in the world around us, as an opportunity for a discussion, and really having a sense of what impact is this having on me, and having a partner that I can have those conversations with without feeling judged, without feeling overwhelmed or embarrassed by that conversation. In fact, we may have altered or differing arousal templates, and that's not a problem as long as we're talking about it and able to make sense of how we can meet together in an area where we will both feel a satisfaction in our connection around that. I have no idea if I answered the question, though.
I think you did. Okay, just a couple of more. Dan, is recovery on my own possible?
No.
Ditto.
Okay.
And I'm not being facetious with that either. I admit that there's a bias that I have with that. Just I would assume that there are those that have recovered doing their own work. One doesn't have to seek out therapy in order to heal. There are 12-step programs. There are many other resources. I am just not aware of anyone who's done it on their own, but maybe it's because they haven't reported that to us, and they're not really a part of the research that's done out there. I'm not certain what it would mean to do it alone. That would assume that one lives in a vacuum. I assume that the question is in reference to not doing therapy, not doing 12 steps, not sharing it with the person, with a church leader or anyone else. I would just say maybe it's possible, but why take the chance? It's too precarious, and there are too many resources. In my mind, it would be imprudent to try to do this alone, and why extend the period out so far that then if I am not able to do it alone, then I've had another year or two or whatever of pain and hurting other people. So I would just say, don't take the chance. Can you climb a mountain by yourself and without all the safeguards and support around you, without ropes? Yeah. Is it worth the risk?
Right, Dorothy. What is there available for spouses whose husband is an addict and has been imprisoned, not willing to give up on him and needs support to help him? He's got an addiction, he's not evil. Need to move beyond the registry and have peace, not judgment.
I'm visual. Okay. Well, there's a lot of support. Okay. I'm trying to think. I have a client right now whose husband is in prison, and there is an online community of women who are dealing with kind of their own response and healing, and they're kind of from across the country, and they stay very, very connected. I know that there are programs within the prison, typically if you're in for some sort of sexual, probably if you're in prison, you've done some child pornography and on the sex register that way. And I know that they do a lot of treatment there, and there needs to be a lot of aftercare, and that can be a resource, is finding out that process of what he is going to be needing to do. And I'm assuming there's some support there for the partners. I think the woman that I happened to work with sought support from and therapy and joined with women whose husbands were not in prison but were still imprisoned by their addiction, and gained a lot of support and growth by being involved in her own therapy. And the other women were very accepting and non-judgmental, knowing that with this, they were grateful that their husbands hadn't crossed that line, but understanding that that happens, and so it wasn't a place of judgment for her. Yeah. Okay.
Okay, this is the final question that I have, so I sincerely hope that you have had your questions answered. And thank you. I will ask the final question. Mark, let's have you address it, and then I will give each of you if you want to make a final statement. I love my wife. I did before we married and have throughout our 10 years of marriage. However, I have been addicted to pornography the whole time I have known her. Is it possible to love my wife, yet still have a pornography addiction? Can the two coexist, i.e. love and my addiction?
Absolutely. Having an addiction does not nullify your capacity to love. In fact, the very struggle that you're having with it in that relationship indicates that you have great concern about the impact that your behaviors have on this loved one. That being said, it doesn't prevent me from actually doing harmful things to somebody that I love. It doesn't take an addict to harm somebody that they care about. That's a very common human trait. We can harm people that we love and that are closest to us, intentionally and unintentionally. And so it's never been a question with me or the clients that I work with about whether they love their spouse or not. It's learning how to love them differently than they have, learning how to love themselves differently than they have, and learning how to have a healthy connection with themselves first and foremost, with higher power God, then with their spouse. And when they can get it in that order and not the other way around, then they start to get some movement. So I think it's a great question. It's a fair question. It's one that the betrayed spouse would often ask, did you ever love me? Can you even love me? And it's never been a question of intention. It's been a question about their execution of that love. And it's therapy and counseling and recovery is a great forum for teaching and training us how to have healthy attachments, healthy connections away from the distractions that we've used to escape from our inability to do it well. And in our practice, we call it intimacy disability, and we work to create intimacy ability. Great question, though.
If I could just comment on that, too, that very simply what came to my mind is that one can compartmentalize pretty well, and many addicts are very good at compartmentalizing their life. And so there can be a life of pornography use, self-indulgence, and so forth, and then really profoundly loving one's spouse and children. The question that I would ask with it is, can the spouse fully feel that love if that dual life is in place? Mm-hmm. And I would just say probably not.
Good statement.
So one might be able to feel that love is expressed and given, but I think it's very difficult for a spouse to really feel your love if that oxytocin, that bonding hormone, is getting shared with multiple other women, if the attentiveness and affection is being then channeled elsewhere, that there's not that focus on that one woman in your life. I think then the joint experience of love is compromised significantly.
Nice.
Excellent, thank you. Young lady, you have a question, please.
Well, I was trying to write it down, but I felt like I was writing a book instead. But,
Well, thank you.
The panel is how can you help others in their recovery journey? I have a son in prison, and he's now going to be a sex offender if he ever gets out, but how can I help him, because he has nothing. They'd give him nothing until he has a parole hearing in 3 years. So he's just sitting there, and he's trying. When he was in jail, I could send him books, and They loved it, and they shared all the books that I sent. And now in prison, you can't send him books. So how can I help him?
Can you write him letters?
I
Are you
can,
able
yes,
to write letters?
That's all. I can write him letters.
And then I would do that.
And
If
then
that's-
I've got he has 3 younger brothers, and I've tried to talk to them, but they don't want to open up. We tried to get them to go to therapy, but none of them wanted, because they said, one of the oldest ones said, I don't want to go and talk to someone who's paid to listen to me. So they don't even want to go to therapy. And I feel like therapy is going to bankrupt us, seeing how much it costs. So, and you say don't do it by yourself, but that's what we do.
I'm sorry to hear that story. That's pretty painful. I'm wondering if you have access to a spiritual leader or a pastor or someone who can be there in that function, in that capacity, especially, with your boys. That you try to find perhaps some, with writing letters to your son and bringing the boys in with a spiritual leader that may be able to help them and guide them in a way. Or to get with someone where you can brainstorm on, how do I do this? Because it sounds like you're going to have to become incredibly creative in how to reach your boy.
I understand not being able to send books, but if you can write letters, write many condensed books. You can quote as many authors and research and recommendations. You've probably received some good information here today that could fill up probably volumes of pages. So if he's open to that, I'm not talking about breaking or beating the system, but in this situation, boy, I would, as a parent, I'd be writing my boy some a lot of condensed books for me.
Thank you. We'll take this final question because it is nearing the end of our conference, and we thank you sincerely. But young man, if you would.
Sorry, he still needs to ask his question. I just want to say I'm an addictive recovery missionary, an ARP missionary, and we have classes for spouses and family members that don't follow the 12 steps. We have 12 principles, which are geared for people who are hurting because of their loved ones and the choices that they're making. And I know there was a booth, wherever those booths were, and they have schedules. And so of where they are and when they are, and they have call-ins as well.
Okay.
They're pink. They look like this, and they're call-in. I mean, you can call in and not actually show up. So just for that information.
Helpful information. Thank you. Okay, sir, if you will ask your final question, please.
So it was kind of briefly touched today. This goes more to the psychological, point of view. There's lots of opinions about this topic, and I just want the psychological. It's been talked about how there's the good sex life and then the bad sex life today. And so I'm recently seeking, I guess you could say, marriage with a young lady, and we're going to wait until we're married to do such things. But upon seeking that, we do talk about such things as well, and we've noticed that we have similar, I guess you could say, the term is fetishes, and I'm curious, if we acted out with those fetishes together, would that be a good thing psychologically or a bad thing?
That is actually an amazing question, and I really appreciate that you and your spouse-to-be are having these conversations. It's something that the majority are not having, and it's important to do it in a safe way, obviously, but at the same time, it's important to be able to have a transparent communication. So to answer that question would require probably a little more time to get some idea of what perhaps the fetishes are and what it may be serving with each of you. For one, it may be a healthy experience. For somebody, the other person, it may not be. And so there's not actually an answer I can give you over the pulpit, but that would actually be a really great discussion with a trained clinician that can walk with you guys through what that might mean, both the unintended consequences and potential benefits of engaging in that behavior. But it would really require some patience with the process to look at it and be willing to see it from different angles than perhaps you are. Because is it possible it could be harmful to the relationship or self? It could, depending on the context of it and the origins potentially. And in other places, it may simply just be a way that you guys can connect with one another insofar as neither one of you are being abused. It's coercive, or it's against your will, or it's in anything like unto it. But that would require a little more comprehensive review with somebody that you both could trust to have a conversation with. A clinician would really be recommended. But I really applaud you and your spouse-to-be for having those conversations on the front end. Good for you.
Thank you.
You bet.
Thank you. Unless the three of you have a final statement that you would make, I'm going to go ahead and close. Would that be okay? For all of us that have been involved in this conference, we applaud each of you just for being here, for learning, and being willing to enlighten yourself onto this topic. So go home, be safe, enjoy your afternoon, and let's applaud our panelists.